Welcome back to Primetime News, and again, a special welcome if you're watching online at onespotmedia.com. Nearly 1/3 of healthcare workers in the operating theatre department at the Mandeville Regional Hospital are out sick with COVID-19. This has put a strain on the remaining staff, who say they are demotivated and scared amidst the spike in the number of COVID-19 cases in that parish. Authorities concede they are now in emergency mode and have implemented Tier 1 of the COVID surge plan. Giovanni Dennis has the details.
A cloudy day outside the Mandeville Regional Hospital in Manchester on Wednesday. Inside, a cloud of uncertainty and anxiety filled healthcare workers. One staff not authorized to speak to journalists has painted a grim situation at the largest hospital in the southern region. To protect their identity, no audio will be used. The first concern: since last week, over 25 of the 76 operating theatre staff are out sick and isolating with COVID-19. That's roughly 1 in every 3. The remaining staff fill the void, which means overwork and overtime with limited resources. We put this first concern to the regional director of the Southern Regional Health Authority, Michael Bent.
So we can confirm that we have some staff members in the operating theatre department, 30%. So we have a complement in the operating theatre of 75 team members, and 25 of them are out. They are impacted with the COVID-19 virus.
The situation is compounded as the COVID-19 ward is full, with all 20 COVID-19 beds occupied. Our source tells us there is great anxiety among staff.
It is testing the staff because the ward is full, and one has to realize that as a hospital, we do not just manage COVID-19 patients. We have other patients coming in too. And that is why it is very, very important for the public to know that they need to follow all the protocols.
It means the hospital is now in emergency mode and has activated Tier 1 of its COVID-19 surge plan.
We have to move to reschedule some of those surgeries that can be rescheduled and move into an emergency mode. However, what we have done though is to implement our surge plan, the first year of our surge plan. That is, some patients who can be managed into the smaller hospitals, then they are sent there. And as we speak now, we are trying to create another ward at the Mandeville Regional Hospital to facilitate a few more patients, COVID-19 patients.
Our source insists that the COVID-19 tests are taking up to a week in some instances to return. This means patients suspected of having COVID-19 are mixing with patients on the general ward who don't have the virus. Dr. Vitilius Holder is the regional technical director.
It might take a day or two for the results to come in. And so therefore, there are times when the person is on the general ward and they're still waiting for the result, and then the result comes on. So once patients are detected or positive, then they are isolated. So in terms of the ward,
and so there's the concern though that persons who may be positive or who are positive are mixing with other persons who are not.
Once the result comes back, they're not mixed with the other patients, they're isolated.
We're talking about before the results now, because some of them, the results come back even after they have left the hospital, I understand.
No, as I say, all persons coming in are tested, and so therefore they would have been placed on the general ward. It is when we then have the positive results, then we isolate patients.
She insists as much as possible social distancing is enforced, although our source argues the mixing of patients is concerning. Our source also argues that there's a breakdown in communication and staff feel directionless. Mr. Bent insists the information on plans are shared.
Naturally, in any situation, you're going to have some team members or some staff members are going to be maybe not hear about it, but I'm certain that it has been shared among all the team members in all the hospitals.
The usually cool parish of Manchester has been one of the hotbeds of positive COVID-19 cases. On Monday, there were 81 confirmed cases in the parish, the highest daily across parishes. Tighter curfews have been imposed in the parish, with authorities calling for compliance. Giovanni Dennis, TVJ News.
Meanwhile, Jamaica recorded more than 200 confirmed cases of COVID-19 for the 6th consecutive day. This as 207 cases were confirmed by the Health Ministry on Tuesday, increasing the country's case count to 17,908. Kingston and St. Andrew recorded most of the cases with 72, followed by St. Catherine with 38 and Manchester with 33. Meanwhile, COVID-19 has claimed 3 more lives, pushing the country's death toll to 362. Now, the Health Ministry says 171 of the people confirmed with COVID-19 remain hospitalized. 13 of them are critical.